Hi, welcome to week 6 of remote patient monitoring. This week I'm going to discuss one of the ADCES 7 self-care behaviors, which is reducing risks. ADCES says that reducing risks means doing behaviors that minimize or prevent complications and negative outcomes of prediabetes and diabetes. Some suggestions for reducing risks include making positive lifestyle changes, meeting in person with a diabetes care and education specialist, getting enough sleep, and receiving recommended vaccines and health screenings from your primary care provider. Additionally, people with diabetes should get their eyes checked by an ophthalmologist at least once per year and have their feet checked by a podiatrist at least once per year. Your primary care provider should also be obtaining annual lab work to check for kidney function. If you haven't had these screenings done within the past year, it's time to schedule your appointment to get that done. COVID-19 is also something that can negatively affect people with diabetes more than the general population. People with diabetes are more likely to have worse complications if they get COVID-19. To reduce the risks related to COVID-19, it's recommended to obtain the COVID-19 vaccine and booster, wear a mask when it's not possible to socially distance, and to wash hands with warm water and soap often. This next part can be pretty depressing, but it's important to talk about it so that you can be informed. Some long-term complications that can develop with diabetes include heart attack, stroke, decreased vision or blindness, decreased kidney function, numbness or tingling in your hands or feet, slowing down of stomach emptying, foot deformities, sexual problems, and skin problems. The best way to reduce your risk for developing these long-term complications, or to keep these complications from getting even worse, is to manage your blood sugars and lower your A1C. And then notice I didn't say control blood sugars. I don't believe control is a good word because your blood sugar will do what it wants even if you're doing everything right. So as you are managing your blood sugars, doing what you can to keep them in target range of around 100, this is what you can do to help keep them managed. So you're not expected to have perfect blood sugars because diabetes isn't a perfect condition. Just do what you can and reach out for help from your healthcare team when you need it. The American Diabetes Association recommends an A1C of less than 7%, so if you are meeting that goal, then great job. We can all learn some pointers from you. If you're not quite reaching that target yet, then try to decide what you think the main culprit is. Are you waking up with high blood sugars every morning? Are you having a hard time with carb counting? Are you forgetting to bolus 15 minutes before you eat? Are you forgetting to bolus altogether? Think about one thing you can try to do to help keep your blood sugars closer to your target range and work on that for a week. Then see if you notice any differences in your blood sugars. If you need additional support, please reach out to me or another diabetes care and education specialist so we can come up with a plan to lower your A1C that will work for you. This concludes the 6-week diabetes remote patient monitoring program. Throughout the past 6 weeks, we've discussed the ADCES 7 self-care behaviors, including healthy coping, healthy eating, being active, monitoring, taking medication, problem solving, and reducing risks. I hope that you have learned something useful that will help you live your best life, even with that annoying diabetes in the background. Feel free to refer back to these videos if you ever need a refresher on any of these topics, or visit the ADCES website at diabeteseducator.org. If you have any additional questions or have any suggestions for future diabetes RPM programs, please message me in the patient portal. Thank you.